this whole subject of faith and healing is something that we don't want to divide us. We want to unite us, don't we? It's something that is a very powerful part of what we believe, and we want to see how we can exploit that to have a deeper experience for ourselves and also for those who are sick. Because the area of religion and medicine is not something that should be separated. It should be united. And you remember Luke. You remember Luke, the physician? It's actually interesting that Luke, as you know, wrote one of the Gospels, didn't he? And he also wrote the book of Acts. And I think that tells us that doctors should be instrumental in, like Luke, who wrote the Gospel, telling people about Jesus. But also, when he wrote the book of Acts, sharing about ideas about church growth and evangelism. And health ministries is a very tangible way in which we can do this. And so it's important that physicians work closely with members and also with pastoral teams. I don't know how many of you, in your own family practitioners, I don't know how many of you know your doctors very well or regard them as friends. And I know traditionally a lot of people are quite hostile to their physicians, but I think it's important that we can build that link, not only between us and them, but also within our congregations. I think one of the also important messages that we need to take is that as physicians and pastoral teams and church members work together, it's important that we work within the sphere of our limitation, yes? So we understand that we have a skill, we have expertise, we have knowledge, but we don't try to go beyond that. There are things that I would not do because I would leave it for a pastor to do. You understand? And I think we can all have different levels of training, and that's fine to do what we do as long as we do not go beyond what we've been qualified to do. You know, people often talk about this text in the Bible. You remember the woman who had an illness for a long period of time, and it said that she spent all her money on physicians, and she grew worse in spite of that. It doesn't necessarily mean that the physicians made her worse. And sometimes it's just that in spite of treatment, we do get worse. But it might seem that we have difficulty, or we will have difficulty, communicating our belief. And sometimes it feels like there's a barrier between us and our doctors and the medical profession, yes? And I think sometimes as Christians, we withdraw because we think, oh, they will never understand what I believe because they're not a Christian. And it's interesting, I found this piece of research from a survey in the United States show that nearly 60% of people, of doctors, said they believe in some sort of afterlife. Over half said that they believe religion influences how they practice. And the president of the American Medical Association said this: as long religion and medicine are completely compatible. So that is even from a non-Christian's point of view, and it should help us to understand that we do not need to be sheepish about our faith. And I think it's important that even when you go to see your doctor, I'll tell you, it's important that you can be a positive testimony to doctors and to healthcare workers in a hospital. You may be the only person they come into contact with who can tell them about this link between healing and your faith. It's important that they can see in you something different as a Christian about how you cope with disease and how you cope with illness. And I think it also reminds me of the fact that if God is going to use medical evangelism to help preach the gospel, then maybe many of us should think, perhaps, about taking up medicine or nursing as a career. Maybe we should encourage our young people to go into this because we know it's going to play such an important part. Or maybe some of you who are older, who are doing a particular job, maybe God is calling you to change your career. So maybe it's something to think about. And another survey here shows that even though people may not believe in God, they may appreciate the fact or the importance of religion to their patients. So I would say when you go into a hospital setting, or when you're ill, or when you interact with medical profession, don't be shy about your faith, because you never know what a powerful testimony it might be to those who are treating you. Ellen White says this. She says, the sick and suffering will have much more confidence in the physician who they are confident loves and fears God. They rely upon his words. They feel a sense of safety in the presence and administration of that physician. Knowing the Lord Jesus, it is a privilege of the Christian practitioner to, by prayer, to invite his presence in the sick room. Before performing a critical operation, let the physician ask the aid of the great physician. And it reminds us the importance of partnering with God in our work. And so I'm going to give you a case study. I want you to think about this very closely. Joseph is 15. He developed epilepsy at age 3. Since then, he experiences seizures on a periodical basis, every now and again. In spite of medical intervention, his condition remains. Joseph's family have been long-standing members of their local church. I want to ask you, what do you think are the challenges they may face? What do you think are the challenges they may face? I'm going to ask you, what about the patient? Let's think about the problems that Joseph, as a patient with epilepsy, may face. He's 15. What about the stigma? Yes, exactly. When somebody gives you a label of a disease, they say they don't see you, they see you, the epileptic, or the diabetic, or the asthmatic. What about having to deal with taking medication every day? A constant reminder of the fact that you're ill. And also for children who have to take it at school, it might be very difficult. They may feel very shy or embarrassed about having these problems. Perhaps he's not able to do certain activities like go swimming, or later on go driving or riding. When he gets older and may want to date, he might find it very difficult. It might even affect his belief in God, because as a child, he's had a condition that has been with him all the time and is not going away. And then what about his brothers and sisters? They may feel that because Joseph is receiving so much special attention, that he's special, and they may feel left out. Or they may feel that in some way he's inferior. They may feel embarrassed about him. They may suffer because the parents are spending a lot of money on him and there's not enough left for them. Maybe they can't go on holiday because they can't take Joseph with them. Maybe they miss out on certain opportunities. And what about the parents? You know, if you have a young child who is sick, you may be thinking, was it something that I did before? You heard about it this morning, about epigenetics. You may be feeling guilty as a mother or father. Is it because of me that my child is unwell? Something that I used to do? Is it because of my family or some genetics in my family? You may feel that you may feel upset because you had to stop work to look after your child. Maybe you couldn't pursue your education or you couldn't do as well in work as you would have liked to have done? What if it affects your relationship with your husband or wife? It might be that you have less money available because you have to look after that. And then it might affect your relationship with God as well. And it's important to appreciate that when people suffer from a condition, we do not look simply at the condition, but there is a wider sphere of things that take place. And so we do not treat simply the disease. And if we can appreciate all the other areas that are affected by the disease, we can also look at areas where healing can start. Yes? This story is a paraphrase somewhat of what we see in the Bible in Mark chapter 9. Do you remember when the young boy and his father came to Jesus after he'd been down from the mountain? And the disciples tried to heal him. The father told about how he would convulse and be thrown onto the floor, into the fire. And he brought his son to the disciples, and the Bible says that they could not heal him. And I would like us to see what lessons we can learn from Jesus as the great physician, to teach us how we can deal with these problems of healing and how our faith can help us. And so one of the first things, if you look in that story in Mark chapter 9, one of the first things that Jesus asks is, what were you discussing with them? He asked the scribes and Pharisees, what were you talking about with the disciples? And the lesson here is, identify, we're looking at illness and faith, identify what the problems and issues are, first of all. Is it a physical problem? Yes. Before you jump in, is it a spiritual problem? Is it emotional, or is it social, financial, relational? Do not, what I would say, medicalize what is spiritual. In other words, if you have a spiritual problem, do not turn it into a medical problem. If we have a medical problem, do not turn it into a spiritual problem. So the first thing to do is understand what are the problems and what are the issues that are being faced. The second thing that Jesus says, he says, "O faithless generation." Now this workshop is about faith and healing. He says, "O faithless generation." In other words, Jesus equates lack of healing with lack of faith. And it might sound strange that as clinicians we're talking about faith so importantly, but what Jesus is saying, that faith is at the heart of healing. If you look at a number of the healing episodes, and interestingly, in the New Testament there are 32, 33 separate episodes of healing. Now that's a different issue, but you might want to reflect that in 3.5 years there are only 32 episodes of healing. But in a number of them, when Jesus has healed someone, he has said, your faith has made you whole, or your faith has healed you. And we should try to appreciate what are the factors that can reduce our faith. One of the problems the disciples had was arguing amongst them, yes? Have you ever been perhaps on the church board where there is arguing? It's difficult to express this kind of faith. It might be because we're focused upon self rather than the patient. It might even be because of health factors that we cannot experience his faith. But there is a difference between having faith and presumption. And as Sharon was talking about early on, you may have seen in your own churches where people decide for whatever reason or another they're not going to take their medication anymore. Have you heard that before? You decided, I'm not going to take medication, I'm just going to trust in God. Now, actually, as far as I know, the only two denominations that expressly forbid medical intervention are Christian Scientists and Jehovah's Witnesses in terms of blood transfusion. As a church, of course, we do not do that, but there may be some individuals who do. And this may be because of lack of education. It might be because of fear of what's going to happen. It might be because of having a bad experience previously in hospital. Maybe they've been given wrong information, or somebody's coming from outside and teaching them false theology. It might be because of their cultural background or superstition. Yes? You know that many of us carry beliefs that we had before we were Christians. We bring it into our faith. Things that do not even belong within Christianity. But because they are so ingrained in what we believe, they're part of who we are, we still hold on to them. I'll give you an example. For example, the Jews. Do you remember when Lazarus died? Well, you don't remember when, but in the Bible it says, one of the reasons it is said that Jesus waited till he had been dead 4 days was because many of the Jews believed that the spirit did not leave the body till at least 3 days. And so he wanted to make sure there was no room for anyone to believe that perhaps Lazarus had not been dead at all. That's one of the reasons he waited for 4 days. It just shows that even amongst a religious population, there can be many superstitious views which have no biblical theology. So we have to take this into account when we're understanding what people are dealing, how people are behaving. And all these points I'm bringing are things that Jesus said in this passage. The next thing that he says is, bring him to me. Yes? Bring him to me. The importance of bringing patients to Jesus. And that could be by our example, by our teachings, yes, by our attitudes, leading people to the one who heals. Another way of saying this is that when we experience ourselves or other people who have a medical problem, don't leave God as a last resort. Don't try everything first, and if it doesn't work, then say, well, I'll pray. It's important that the first thing we do mentally and physically is bring the problem to God. By all means, do all the other things. But let's not leave God until everything else has failed. And Jesus says, bring him to me. And I think that's a lesson for us. Bring our sick ones to God, whether physically or even in prayer. One of the next things that Jesus says in this passage, this is very interesting. He says, how long has this been happening to him? Now, in the Gospels, this is the only time when Jesus asks this question. The only time when he asks, but it's important because once we have ascertained what the problem is, we need to know what the nature of the problem is. Yes? We need to know. And This is somewhat analogous to those of you who work in hospitals, taking a history and doing an examination. You ask lots of relevant questions, and you need to know, is it a physical issue? Is it spiritual, as I said before? We need to ascertain the facts. When Jesus was speaking to the man said he'd be thrown down, he would convulse, he'd be thrown into the fire sometimes, and he gave him a specific breakdown of what was happening. And it's important for us not to jump in, but to have an intelligent understanding. And this may need more than one type of person. We need to understand their physical history, yes? Any previous illnesses. We need to understand what's their spiritual background, yes? Emotional. Are there any tendencies towards depression, for example? You know, how do they interact with others? Is there a history of alcoholism or substance misuse? What is the nature of the problem? And the next thing that Jesus says is, if you can believe, all things are possible. If you can believe, all things are possible. This is in response to what the man said to him, Lord, I believe, help my unbelief. Do you know what this means? Lord, I believe, this is my effort. This is what I do. Help my unbelief. This is what God does. So this is how we should approach healing. Human effort plus divine aid, working together, not one or the other. And this is why it's important when we have the same idea about, should I use medication? Should I go and see the doctor? Should I have an operation? And people say to me, I've got this condition, but I don't want to take the physical route. I want to take the spiritual route. We should not try and separate spiritual from the physical. There are it is our job to do all we can, yes, to obtain the best health and then allow God to work. This is what Ellen White says in the book Ministry of Healing. It says, those who seek healing by prayer should not neglect to make use of the remedial agencies within their reach. Listen, it is not a denial of faith to use such remedies as God has provided to alleviate pain, to aid nature in her work of restoration. It is no denial of faith to cooperate with God and to place themselves in the condition most favorable to recovery. Do you see that? It is not a denial of faith to use appropriate medications or to have an operation or to seek medical intervention. But God says this is faith in practice when we seek His will, when we pray for guidance, and we follow the path that He's asked us to take practically. Do you see how that works? It is not a case of either or, but it is using both together. Now, this is something that is perhaps a little bit contentious. You remember I talked a bit before about this boy Joseph who had epilepsy, yes? And I said that this is a bit of an analogy with this story in the Bible. Now, somebody tell me, this boy in the Bible, what was his condition? Somebody said epilepsy, someone says convulsions. All right, interesting. Now, our brother says the Bible talks about demons, so which is it? Yeah. When you said he had epilepsy or convulsions, let's think of it in this way. Let's think in this context of epilepsy as a symptom rather than a disease, yes? This is another issue that perhaps we don't talk about very much, but interesting, when Jesus approaches the boy, he didn't say, "You are healed." He says, "Come out of him, you spirit, and do not go back into him." Yes? So what did he do? He cast out a demon. So a question is, how do we know whether somebody has a medical condition or is demon possessed? How do we know? Let me hear some answers. Can you tell? So our brother was saying, are we talking about a state of mind because of the Old Testament references? But that raises some very interesting points. And I have an I'll come to that in a minute, but you know, when people talk about Saul, for example, they say Saul was what we call a manic depressive, or perhaps we would say now he had bipolar affective disorder. He was up and then he was down. Yes? And yes, and these are the labels that we put on them now. And this boy, we say he's epileptic. But it's important to note that just because you can assign a clinical label, it doesn't mean that it doesn't have a spiritual origin. Does that make sense? Yeah? Just because we can give a name to it doesn't mean it is not of spiritual origin. And yes, I did ask that, yes.
Probably the proof of the pudding's in the eating. When Jesus cast them out, something happened, like those pigs went into the
yes.
thing. So there's some correlation there. It must have been a demon, not the human.
Yes, and I think, thank you, that there was an actual result of what he said. But I think also it's interesting that Jesus specifically addresses the demon rather than the disease itself. Do you see? He's actually talking. So this is what I've said here. We need to treat the problem. And I'm going to, for example, in Matthew chapter 10, verse 8. Now, people may say, well, you know, speaking in the language of the day, that because people didn't know about medicine or didn't have as much knowledge, the way they would understand it would be to call it demon possession, yes? But notice what it says in Matthew chapter 10, verse 8. When Jesus is speaking to his disciples, he says, "Heal the sick, raise the dead, cleanse the lepers, cast out demons." Yes? Heal the sick, raise the dead, cleanse the leper, cast out demons. So what he's saying, he's making a difference between physical healing and spiritual. Do you see? In other words, it is not that we are using the same language as for the same condition. He's making a difference. He says some conditions are physical, some conditions are spiritual. And that, I believe, is why you see Jesus dealing with illness in different ways in the Bible. But this is an area that perhaps we do not talk about. And this is what the Bible commentary says about this. This is very interesting. It says, so far as inspiration has indicated, the various manifestations of physical and mental disorder that marked the demon-possessed were, in and of themselves, no different from similar manifestations attributable to natural causes. Apparently, the difference lay not in the nervous and physical symptoms displayed, but in the agency that caused them. You see? So in other words, it's not necessarily how the disease manifested, but what was the underlying cause. And this is Dr. John White in his book, Commentary on Psychological Observations in Demonism. He says, I can conceive of no demonic state which cannot be explained by a non-demonic hypothesis. I can likewise conceive of no experiment to give conclusive support to demonic rather than parapsychological hypotheses. In other words, it can be very difficult to tell. But this is why we have to have this holistic view to healing, and it also explains why we cannot rely solely on prayer to the exclusion of other methods of healing, and we cannot rely solely on physical healing to the exclusion of prayer. Physical problems have a physical solution. Spiritual problems have a spiritual solution. And the last thing Jesus said, there are 7 statements that Jesus makes in this passage. He said, this kind comes not out by prayer and fasting. After they had failed, Jesus said, there are special situations which require special approaches. And I think as physicians, as nurses, as pastors, as healthcare professionals, we need often a period of reflection when we can think to ourselves, did I approach that patient in the best way possible? And I'm sure there are times when you can look back in your congregation, amongst your friends and relatives, was this the best way to approach this problem and this patient? Are there things I should have done better? Are there lessons to learn? Yes? And it's very nice when people thank you and praise you because you played a part in their healing. But we must also be prepared sometimes to accept criticism and sometimes to learn lessons of how we can do better. Yes? And so I hope that this has helped serve as a platform to understand the interface between faith and healing. And throughout the rest of the afternoon, we're going to explore some of these issues a little more deeply and to see how, from a medical and pastoral point of view, we can really be the most efficacious and promote healing in our churches. Thank you.